Thanks for staying with us. Now, the Director General of the Ghana Health Service, Dr. Anthony Nsiah-Asare, has advocated a discontinuation in the posting of health professionals to health facilities by government. Dr. Nsiah-Asare believes stopping the practice will enable a fair distribution of health staff across the country and will also give graduates the opportunity to personally apply for available jobs in the regions they so desire. It has become a common phenomenon to see a number of unemployed health professionals picketing at the health ministry to be posted. The trend has become a challenge for the sector ministry to deal with as it keeps recurring. Speaking at the opening ceremony of the annual conference of the Christian Health Association of Ghana, CHAG, in Sunyani, Dr. Nsiah-Asare said the measure, if adopted, would benefit all in the health sector.
Hundreds of unemployed health professionals have on many occasions stormed the premises of the Ministry of Health to demand jobs from government. A number of them have maintained that having been bonded, they have no choice but to depend on government for employment after their training. This, however, has been met with disappointing responses from successive governments, largely due to overwhelming numbers and change in political administrations. Though past and present governments have made efforts in addressing the situation, very little has been achieved as the problem persists. Addressing health professionals at the annual conference of the Christian Health Association of Ghana in Sunyani, Wednesday, July 27, 2018, Director General of the Ghana Health Service, Dr. Anthony Nsiah-Asare, called for a stop in the current practice where government posts graduate health personnel.
Inadequate and equitable distribution of health professionals continues to be a major challenge for the health sector. So much depends on having required skilled human resources in the right numbers and the right skill mix for effective delivery of health services. Continuing just to talk about it without resolving it with all seriousness it deserves will only undermine all the achievements we have jointly scored over the years. We need action and not mere reports and resolutions. The present bottlenecks in ensuring staffing of all existing health facilities simply have to be tackled now, not tomorrow. I'm urging your conference to come out with pragmatic measures to address this long-standing challenge in the health sector. And I believe we should stop posting. We should allow every health worker to go and look for a job. We declare gaps and people will go to the regions where the gaps are, where the work is, and they will go apply, go for interview, and accept the jobs. On that note, we are also fighting seriously that we believe that financial grants should come with no names attached to it. And in that way, we can then ask the regions to do their interviews and accept people in the various regions.
Dr. Anthony Nsiah-Asare also blamed the current no-bed crisis on systematic failure. He said the Ghana Health Service has issued directives to health facilities to ensure the situation does not get out of hand. This follows a recent incident in which a 70-year-old man died after he was turned away from 7 hospitals with the excuse of no bed.
What happened that we lost a 70-year-old man was simply a systemic failure. It was nothing else. But as previous speaker said, it only happens in the big cities. No bed syndrome is not in Sunyani. No bed syndrome cannot go to Tamale because the people there will not agree. No bed syndrome is not in Takrari. No bed syndrome is in Accra. And it's circulating among some few institutions in Accra. And the whole idea about no bed syndrome is that we don't have strong pre-hospital care. We don't have organized emergency systems. We don't have good and efficient bed management system. We don't have, we are not following the referral system policy that we have all put together. And in some cases, staff attitude. The people who say there's no bed syndrome is that sometimes have no locus. A security man, or sometimes somebody who is not even working in the institution will be standing at the gate, and then you direct everybody that there's no bed. Maybe somebody has told you are going to sleep, so there's no bed. Meanwhile, sometimes there are beds in the main ward because we keep patients in our emergency rooms for 3 weeks.
He assured government's continuous collaboration with the Christian Health Association at all levels in the provision of better health care. The health sector, according to Dr. Nsiah-Asare, has seen some significant improvements in service delivery, but admitted some painful challenges still confronting them, including high mortality and inadequate health infrastructure and equipment. The Director General, who is also board member of the National Health Insurance Authority, said ambulance expenses during emergency situations should be catered for by the health insurance scheme. The Executive Director of the Christian Health Association of Ghana, Peter Yabua, said the major challenge the association is grappling with is funding.
I think we've met here strategically to review how can we build a resilient, responsive health system as Christian health service providers. We are trying to explore mechanisms. Definitely that will include cost minimization. We want to avoid waste in our system. We want to also look at efficiency gains. We also want to have a funding mechanism that removes all financial barrier in access to healthcare. That's what universal health coverage is about. That's what our ethics, principles, and values as Christian health service providers is about, providing equitable access to affordable quality health care.
The three-day conference under the theme, Building Resilient Health System Toward Attaining Universal Health Coverage, the role of the Christian Health Association of Ghana, attracted lots of dignitaries, including former Deputy Director General of the World Health Organization, Dr. Nsiah-Asare, and some key traditional leaders in the area.
Let's focus on the call by the Director General of the Ghana Health Service for government to stop posting health professionals who have completed their training. What could the implication be for the graduates themselves? Joining us on phone is the National President of the Ghana Nurses and Midwives Trainees Association, Batia Semi Ulati Santi, to tell us more. Hello, Santi. Good afternoon. Good afternoon, Santi.
Good afternoon.
What do you make of the call by Dr. Nsiah-Asare?
Okay, thank you very much, and good afternoon to your viewers. I think with the submission made by the Director General of Ghana Health Service in relation to nurses applying for jobs and to go for interview, with the directive aiming to get nurses staff at all the facilities as expected to render healthcare delivery, I think it is important we have nurses in all the facilities across the country to render healthcare delivery to our people. But the tangent and the directive in which they want to go, I see it not to be the solution to the problem. Why am I saying that it is not the best way to go? Policies in this our country and on the health sector specifically, as they appear on paper or document, it is not the same way they appear when they are to be practicalized. Now, if you want nurses to apply for jobs, and we all know that the Nursing and Midwifery Council and the Ghana Medical and Dental Council are councils that have been established with core mandate to examine and license and
Hello, Santi.
Sure.
Santi.
Hello?
Yeah, we can hardly hear you. Please reposition yourself.
I said that the directive by the Director General of Ghana Health Service indicating that nurses should go for interview and equally apply for jobs as a means to addressing the staffing issue within the health sector is not the best way to go. Based on the fact that these directives and
right,
policies...
Santi, this is not a directive. This is a suggestion.
Yes.
Yeah.
Some of these policies they are bringing on board or suggesting, I see it not to be the best way to go because usually, as we see them appear on paper, it is not the same way when we are to practicalize them. And this proposal, should it be accepted at the end of the day, is going to cause more room for favoritism, corruption, and bribery to take place. It will be a medium for people to now seek for protocols from MPs and other politicians to help them get to where they want to work. Meanwhile, we know as a nurse, if you are being trained, you need to work. And if nurses indeed we say we want work, when our clearance comes, post us to wherever you think our services are needed, but not to tell us to apply again and go for interview. Because going for this interview is more or less like it's going to undermine the license and certificate we have acquired. Notwithstanding, the Nursing and Midwifery Council stands for a core mandate. So if the solution to this problem is what they are seeking for, we advise that we should go by the orthodox approach, where when Nursing and Midwifery Council license us and forward our names to the Ministry of Health, they request for the financial clearance and post nurses to wherever they think they need our services. Just as it is done for the teachers, the police, and the soldiers. When you finish your training, they should post you to wherever your services are needed.
Right.
Should they post you and a nurse now says that he or she is not ready to work, then the person has done that at his or her own peril.
Right, thank you very much.
That this medium will give room for bribery and corruption to take place. At the end of the day, the goal of getting nurses to the remote areas will not be achieved because...
That was Nsiah-Asare. He's the head of the Midwives and Nurses Trainees Association. Our producer of the number 12 investigative piece, Nsiah-Asare, has dismissed allegations that he has entrapped former president of the GFA, Kwesi Nyantakyi. He's been accused of trapping the beleaguered football administrator in order to expose him as a corrupt official. In an interview with me this morning on the Super Morning Show on Joy FM, Anas told me he rather felt entrapped by Kwesi Nyantakyi. He also maintained that the expose was well produced to meet international standards, and he will continue to defend the quality of work put into it.
Look, let me give you maybe a blow-by-blow account of which is what I'm sure you want. We get him out of the airport. And, you know, usually when you meet a visitor, you want to do debriefing. So we get into a room. And then we introduce ourselves. We say, okay, we are the agent who will lead you to this businessman. And this is the nature of the businessman. And this is the kind of business the businessman does. Then the man is listening attentively. Then he maps out a strategy. There and then. Me, I had no idea that even you can charge the GFA between 20 to 25%. It is the man who told me right there and then that, look, what we have to do is that we have to charge the GFA. The president of the GFA teaching me how to scam the GFA. That's exactly what happened. So when I hear that it's you entrapped you, did I force him to say those words? I didn't force him to say those things. After that, he taught me that even the company, that the Mid-Gulf company that we were representing, we could also charge them 5%. Did I say that? He said those things because he knows it, left, right, and center. So he proposed all this and told us that we were going to have our cuts in all this. I didn't say that for him. And those who say that perhaps maybe it is the money he saw that he said what he said. No. After that conversation, when we went to meet the businessman, the money didn't play up. He repeated all these things, how to make the money, how to take this, how to take that, to the businessman. It was at the last encounter that the money issues came in. So I felt entrapped by him. That's how I felt, that you are coming to start an investigation that you've drawn strategy, very long strategy. The man just comes out of the airport. Your first meeting, he's giving you everything on the silver platter.
That was Nsiah-Asare. Now, scenes of children crowding around a mono desk or sitting on the bare floor, jerry cans and on door falls to write are commonplace in schools in rural Ghana. Nonetheless, getting pupils to appreciate simple technology and apply it to address their own furniture challenges can be exciting and fulfilling. That's an innovation an educationist in the Ashanti region is proposing, using plastic bottles to build chairs for school and domestic use. Outgoing District Education Director for Setre South District, Jocelyn Asante-Boama, is spearheading the project. Love FM's Kwesi Deborah takes us to a community where it's being piloted.
It's Friday afternoon at Nsiah District Assembly Basic School. Stage 2 pupils are rushing in for the next English lesson. is survival of the fittest, as a little delay by anyone means no seat for them for the period of the lesson. The situation has led to persistent absenteeism, especially at the kindergarten section. Head teacher Damboyi Jabon is worried.
Seeing them sitting down, sometimes even they have to lie down on the mat, is not very good.
What has become a stubborn environmental pollutant, plastic bottle, is however being used to address this widespread challenge. The process involves cutting off the upper quarter of one bottle and placing it on the top of a whole one to form a bottom piece. The pieces are arranged and bound together with a sellotape. The base is formed first, followed by the armrest and the back. They again bind them with sellotape to get a firm frame. Finally, they cover and decorate them with fabric to give it a pleasant look. The brain behind the innovation, Madame Asante Boama, says is meant to encourage creativity in children while solving environmental problems.
When the child acquires the skill of creativity, he or she can delve into diverse areas, and which will help the child in future. To support the government also to keep the environment clean, to help them come out of petty ailments that could be worrying them. Spinal problem here. As for the malaria, you cannot talk of it.
It's a relief sitting on it. We weren't happy sitting on mats. It's very comfortable. We're very happy. Madame Asante Boama is hopeful the smiles on the faces of these young ones will spread to other parts of the country. Certainly, initiatives such as Nsiah-Asare Plastic Bottle Chair Project will force no child out of school just because they have no chair to sit on it. Reporter for Joy News, Kwesi Deborah.
Now, the Ministry of Science, Technology and Innovation says it will establish science parks and innovation centers nationwide to promote learning. Deputy Sector Minister Patricia Appiagyei says the facilities will provide an avenue for practical study of science-related subjects. She told stakeholders at a science and technology seminar in Kumasi for females in basic schools the centers will be ready by end of this year.
Says the initiative will build children's problem-solving skills and increase female involvement in science, technology, engineering and mathematics.
Because we believe that we need to make science an interesting subject, and therefore it is very important that we set up science parks across the regions of the country to ensure that children will understand, they will make it a practical, they will have a practical understanding of whatever they are learning.
Senior research scientist at the Ghana Atomic Energy Commission, Dr. Nanama Brown-Kluche, entreated teachers to find innovative ways to teach science.
Encourage a child or a student to whip up the interest in science. Teachers can do this in so many ways, teaching the subjects rightly and also encourage the students to learn the subject. One important point is encouraging the student to ask questions, as many questions as possible.
The two-day Science and Technology Seminar Series in Kumasi was spearheaded by the NIDA Alumni Network Ghana with support from the College of Science, KNUST. Professor Ibok Odro is provost.
There's also lack of interest, especially when it comes to the science-based courses at career, because most of us think that it's preserved.
The Danida-funded program seeks to whip up interest of girls in science. Lydia Otu is treasurer.
This program was organized for females in Nsiah-Asare Junior High School. The program seeks to expose these girls to the sciences, the courses in the sciences that we have here in the university, and we aim to raise awareness in these courses and expose them to career prospects.
Reporting for Joy News, Kwesi Deborah.
And on that note, we end today's bulletin of Joy News today with me, Daniel Dazi. Before we go, let's take another look at our top stories. Director General of the Ghana Health Service, Dr. Anthony Nsiah-Asare, called on government to stop posting graduate health professionals as a measure to ensure fair distribution of quality staff across health facilities in the country. Ace investigative journalist Nsiah-Asare debunked allegations suggesting he entrapped former GFA President Kwesi Nyantakyi in order to expose him as a corrupt official, insisting he rather felt entrapped by the former GFA President. And on Tech Thursday, we told you the innovation by an educationist where plastic bottles are used to construct furniture for school and domestic purposes. And the National Science and Maths quiz has entered the quarterfinal stage. In the first contest, Infantswim School proved victorious with a 19-point gap between them, SEC Legon, and KNUST SHS. For more news, log on to myjoyonline.com. Do stay tuned for the marketplace with Emmanuel Abuajiriafi, but it's bye from me.